Here's a quick example using a model of how we demonstrate and talk about stretches post a tongue tie release when the wound is open. So underneath the tongue, the wound's always going to be right in the middle with this kind of right under the tip of the tongue. We're not like rubbing on it. We're not pushing into the wound directly at first. It's more kind of lifting up above it and around it. The wound's going to look a little bit more like a diamond, so just going more on the edges of it. So I'm lifting the tongue, kind of backing up towards me, scooping it up, then I'm pushing down on the lower kind of lips or the chin to help keep the mouth open. So I hold that for 5 seconds. So I'm just right above where the wound is. Then I'm going to take one finger and go more towards the side of the tongue. I'll do one side at a time. And I'm going to push under the tongue down into the floor of the mouth where it's soft. And then I'm going to kind of like taco roll, kind of roll the side of the tongue up, trying to get it to curl up. And then I'm going to use my other hand on the gums of the lower jaw and try to help hold down and keep the mouth open. So I'm kind of pushing down, lifting up, holding that for 5 seconds. And then I'll go to the other side where I'll put finger on the lower gums to help hold the mouth open. I'm going to push into the bottom of the mouth where soft, and I'm going to roll the side of the tongue up and hold for 5 seconds. So the stretches for underneath the tongue are those 3 5-second lifts. And those you just have to do one time each of the 4 rounds that I will recommend throughout the day.